Here's a startling fact. Nearly 1 in 4 breast cancer diagnoses are now occurring in women under 50, according to a groundbreaking new study. This finding challenges the long-held belief that breast cancer is primarily a disease of older women and raises urgent questions about how we screen and care for younger populations. But here's where it gets even more concerning. Many of these cancers are being discovered in women with no symptoms, often through routine screenings. Could we be missing critical opportunities to detect this disease earlier in younger women? The study, presented at the Radiological Society of North America's annual meeting, analyzed data from a community breast imaging facility over an 11-year period. Researchers found that between 20 and 24% of all breast cancers diagnosed were in women under 50. What's more, 41% of these cancers were detected during routine mammograms in women who had no symptoms whatsoever. Another 59% were found during diagnostic exams prompted by symptoms like lumps. This highlights a glaring gap in our current screening guidelines, which largely overlook younger women. Dr. Stamatia Destounis, a breast imaging specialist and lead author of the study, notes that younger women consistently represent a significant portion of breast cancer diagnoses in her practice. Yet, there are no standardized screening recommendations for this age group. We're seeing faster-growing, more aggressive tumors in these younger patients, she explains. This isn't just a numbers game, it's a call to rethink how we approach breast cancer prevention and detection. And this is the part most people miss. The tumors in younger women were more likely to be invasive, over 80%, and high-grade, about 1/3, meaning they grow quickly and are more likely to spread. Nearly 9% were triple-negative breast cancers, a particularly aggressive subtype with fewer treatment options and poorer outcomes. These findings align with national and global trends, according to Dr. Beth Terry, a professor of epidemiology at Columbia University, who emphasizes that you're not too young to have breast cancer. But why is breast cancer on the rise in younger women? Experts point to a complex interplay of factors, including genetic predisposition, hormonal changes, like earlier puberty and delayed pregnancy, obesity, alcohol use, and environmental exposures. Here's the controversial part: endocrine-disrupting chemicals, EDCs, found in everyday products, plastics, cosmetics, cleaning supplies, are increasingly being linked to breast cancer risk. Dr. Terry's research at the Silent Spring Institute has identified over 900 such chemicals. Could our modern lifestyles be silently fueling this trend? These findings make a compelling case for personalized, risk-based screening in younger women. Instead of relying solely on age-based cutoffs, experts argue that factors like family history, genetic mutations, and lifestyle should play a bigger role in determining when and how often women are screened. For instance, women with a strong family history of breast cancer or genetic mutations like BRCA1/BRCA2 might benefit from starting screenings as early as 30. So, what should younger women do? First, educate yourself about the signs of breast cancer. Look for changes like new lumps, breast size or shape alterations, nipple inversion, persistent pain, or skin changes, redness, swelling, dimpling. Second, don't dismiss concerns because of your age. Advocate for yourself and discuss your risk factors with your doctor. And finally, let's start a conversation. Should screening guidelines be updated to include younger women? Or is the focus on personalized risk assessment enough? Share your thoughts in the comments. This is a discussion we can't afford to ignore.